Hey everybody, I'm Dr. Pete.
I'm Dr. Carla.
Welcome back to CHIRO Coffee Chats. This week we are going to be talking about headaches. And we have, if you follow us on Instagram, we talked earlier in the week about how there's no such thing as normal headaches.
Correct. Yes.
Which sometimes is a surprise because people might think that
well, it's just part
normal.
of my daily life. Yeah.
Yeah. So that's important to understand. If you're out there, you're watching, you do get headaches, you know, and even if there are triggers, because people say, well, yeah, well, I guess I don't get that, but well, when the barometric pressure outside changes or the weather changes, I get a headache, and that's pretty normal. Also, do you get a headache when that happens?
Not usually. Mine is more kind of monthly. I'll have like one pretty bad week of headaches.
Okay,
migraines.
that's a different situation.
Yeah.
But you don't get a headache. Oh, it's cloudy out or it's raining. I don't get a headache. You shouldn't get a headache when it's cloudy or rainy or snowing or damp out. If you are, what's that telling us? I would say that what that's telling us is that when the outside environment, we can talk about two things, outside environment, inside environment, but when the outside environment changes,
right,
then there's some adaptation. Even if we talk about, let's say, the joints of the body, you know, people with arthritis will say that when it rains, their arthritic knee hurts.
Right.
What would be happening there? Well, the joint is two bones come together and there's a capsule around it, and it's essentially a fluid-filled container.
Yep.
So if the outside pressure is changing and the fluid, that affects the fluid pressure inside that joint, that could cause pain. So that's a specific instance where that situation might make sense. But if for a younger person, you don't have arthritis or degeneration of the joints of your spine, you definitely shouldn't be getting headaches when the weather changes.
Right.
So if you are, we tell us as your doctors that there's something going on with the structure and function of your body that's causing that, and then a person that's not getting that, they don't have that problem. So speaking of the structure and function, what kind of things could we see in a person that gets headaches, specifically related to their spine, Dr. Carla?
There's a bunch of different things. So structure and function, if it's affected by something, just like weather, barometric change, pressure changes, that means that your body is unable to adapt to these small daily changes, right? So there has to be something functionally changing within your spine. So we see joints that are restricted. That's exactly what we see as chiropractors. That's exactly what we deal with.
Where would those joints be?
Usually in the neck, primarily the upper cervical joint, so the first two vertebrae right at the base of the skull. And then also accompanying this would be muscle spasms, again, like tight, tender neck musculature, just all that kind of stuff that follows that cycle.
And from one of our earliest videos too, the study that talked about not only the neck, but the upper back, so the upper thoracic region, if those vertebral spinal segments are locked up and irritated, they can irritate the sympathetic nerve endings, which then can do things like change blood flow patterns to the brain, can make muscles tight, and can be a contributor. So it could really be anywhere from basically the base of the skull down to sort of the mid-back could be spinal areas that impact or trigger headaches. So what we're going to do is we're going to pop over to one of our exam tables, and Dr. Carla is going to show you just a couple of quick tests where we might be able to find tissues that may be involved in headaches.
All right, guys. Hi, we're back. Today we're going to be using Dr. Pete as the model today. We're going to be looking at his neck and how the differences from side to side, so range of motion, palpation, and joint restriction could be affecting his headaches. So we're going to start with range of...
I don't actually get headaches.
If he were to get headaches.
Demonstration.
Of course he doesn't. He's well adjusted.
Not anymore. I used to get headaches. We covered that in another episode.
We did.
Okay.
So,
Carla, you're up.
First, we're going to be looking at the range of motion of his neck. So, rotation is one of the primary components I found in headache patients. They will always have a discrepancy from side to side, also with some end range pain, so closing joint angle pain. So, we'll have Dr. Pete look over his right shoulder first, and we'll look to see how far he can go.
I actually do have a teeny bit as I get to the end range of that rotation.
On that right side there.
A teeny little pinch on the right upper neck.
Okay.
I do need an adjustment today. So.
There we go. And we're going to look over the left shoulder. And
Nothing
any pain along there, and you can go a little bit further along this left side.
I feel that and see that.
Yeah, so we're definitely focusing on that right side today. Next we'll do lateral bend, so side to side. Let's do ear to shoulder on the right. Any pain with that there?
A tiny little pinch, sort of almost like at the base of my neck as I side bend to the right.
Okay, and the other side. And how's that feeling for you? Any pain with that there?
No pain, little pulling stretch on the right. So a lot of things on the right.
A lot of things on the right today. Next, we'll kind of go into static palpation. So just looking at the actual neck itself. So musculature, looking for any signs of swelling, edema, anything like that. Dr. Pete's looking pretty darn good today.
I've been keeping up with my
stretching and adjustments.
Well, yeah, I mean, that's such a, and then we're going to talk about that in future videos, is consistency is so important to improvement and maintaining. So we'll cover that in another video.
Next, we'll do some actual like joint play, checking to see if any of the joints are restricted. Again, we're going to focus on that upper cervical area. That's primarily where headache patients experience pain and joint restrictions. So we're going to look at Dr. Pete's today. So we're going to feel from side to side and feeling those joints close down on one another.
Tiny bit tender where you're pressing.
Right, on the side there. And then we're going to have you rotate. And again, we're looking for those joints to open up with each of these movements. Any pain along the left?
That side feels fine.
And those joints open up.
But they open, yeah, but when I turn that way, I get
you feel a little pinch on the right there?
Yeah, the closing angle on the right side.
So definitely Dr. Pete is restricted on that right side, upper cervical, C1, C2 area. This is primarily where we would do our adjustment on Dr. Pete, try and get things moving. Then we'd move down into the lower C-spine and T-spine, looking for restriction of the joints. So I'm gonna have you stay right there and extend. Any pain with extension then?
When you go, that's like where you're T1 there.
Yep.
There's just at the end of, as I'm looking up, extension, there's a little bit on the right side.
And then we definitely have, upper T-spine restricted on Dr. Pete as well, especially on that right side.
That's my area. And I am due for an adjustment. And that's just to reiterate to our viewers, like, you know, some patients will ask you like, oh, do you get adjusted? And it's like, of course we get adjusted. So I get adjusted once a week. I just find that that works best for me because there's a lot of things, right? But our job is physical.
Yep.
So there's that. And I could, like, if I didn't get adjusted this week, I wouldn't develop a headache. But if I left these little tiny things, they get cleared up with an adjustment. If I leave them, and my stretches, but yeah, if I leave them 2 weeks, 3 weeks, then I'll be like other people that, they start to get neck pain or headache or whatever.
Exactly.
And also that sort of, that's really dependent on the shape of the person's spine. So if we, if we have somebody that has degenerative disc or joint disease of their neck, let's say, they're not going to, we adjust them, that's great, but they're, because of the less than healthy structure of their spine, they're going to be tending to have joints that get irritated more quickly, and then consequently muscles over top will get tight. So they will, and it's like kind of like people will say, well, is it a necessity? Well, I guess you could say it's not a necessity, but it's an advantage that I'm hearing people talk about this term assets.
Okay.
So assets in terms of like financial assets, but your body and your health is an asset, or could be an asset, and you want to keep the value of that asset high, meaning keep it functioning well, feeling well, so that everything you do in life is going to be better when you're in a good shape. Versus people sometimes have like, I don't really know what it is, if it's like I'm not sure where it comes from, but like, oh well, I'll tough it out.
Yeah.
Or, I don't need that. I can deal with some pain and headaches.
Yeah. Oh, I'm just getting old.
Yeah, that. Yeah, or I'm getting old or whatever. But why? Like, why you wouldn't do that? These are the same people that wouldn't do that with their vehicle.
Right.
They wouldn't do that with their home or other things. So why do it with your health? The other thing. Oh, I'm thinking of all these things now. This is good.
In the end, what you're left with is your health and the ability to move around and age gracefully with it. So
huge. And you know what? I heard it said, someone said it this way: the math is on your side, meaning that there's, for us and probably most of you guys watching this, like there's a really good chance statistically you're going to live to be 90, 100. So you say, okay, that even if you don't like eat super healthy or exercise crazy, chances are you're probably still going to get there.
Yep.
The question is, from 60 and 70 up to 100,
how are you going to get
what's
there?
that going to be like? Yeah, because if you're like in pain every day and stiff and can't do stuff, that's 30 years. That might suck. Versus it could be like really, really good.
Well, going off on a tangent too, a lot of people, I read this big study saying that a lot of people in their elderly years measured health on if they were sick or not whether they were wheelchair ridden, bed ridden, anything like that. So a lot of people, as you age, their perception of health definitely decreases. Like, oh, well, I can still kind of walk. Oh, I can still walk without my walker most of the time. And that's not necessarily really being healthy. It's more of kind of just getting by. Yep.
Exactly. Well, sometimes patients will say, we'll say, how's it going? And they'll say, well, I'm on the right side of the grass, right? And I'm like, well, it's kind of a low bar, but I guess it's something.
Yeah.
But,
so wouldn't you rather be 90, mobile, thriving? Again, that keeps your mind fit and everything too. And then versus, just having, well, I'm not dead yet kind of thing. So
well, and that's the point is, because even if they end up developing some kind of other, heart disease, cancer, again, treatment-wise, they may survive. So then again, quality of life.
Right.
So that was good. Tangent. That was good. Yeah, no, it was good. That was good. So Dr. Carl, you demonstrated some different things with, and I will tell you too, that when I did have headaches when I was a kid and a teenager, if you did the palpation, so the pressure on the joints, I would have been like jumping. Oh yeah. They were in pain. And they would have been really tender, and now they're not. So wherever you start your journey of taking care of yourself with something like chiropractic, whatever age you are, you can just get better and better, even though you're getting older, which is really cool to think about. So.
Of course. And you become more aware of what's going on with your body too. So you're able to pinpoint things a little bit better. Like, oh yeah, I definitely need to stretch today. Oh, you just become more physically aware of what's going on.
For sure. And we have this week also a testimonial video from a patient that was having long-standing headaches and migraines, and how chiropractic has helped them. So we'll let you guys enjoy that. Thank you for watching. Thank you for subscribing. Make sure to like,
comment, subscribe.
Comment. What would you like to see in future videos? What did you like? What would you like to learn more about?
Yeah. Awesome.
We're good. Okay. Thanks for watching.
Bye, guys.
See you next one. Hey, everybody. I'm here today with Catherine, who's a patient who's been coming to the office for, it'll be 2 years in August. So Catherine has a really cool story about what life was like for her with headaches and migraines before chiropractic care and what it's been like after. So Catherine, welcome. Thanks for being here.
Okay. No problem.
So let's get into, you've agreed to share a bit of your background. So you first had headaches or migraines when you were a teenager. So why don't you tell our viewers about what that was like?
So I initially had a head injury when I was about 9. Saw a neurologist, and he said, yeah, likely to get headaches and migraines as they get older, but they didn't really say how much older I would be when I got them. And I got the first aura-related migraine at work when I was 15. So kind of freaks you out when your vision starts going and you don't know why. And then I've had, it's really scary when you're at work and all of a sudden your vision kind of starts to blur over, not sure what's going on. Then they would come on a fairly regular basis. Stress would definitely set them off, which is really bad because I have a high stress job. And nothing would ever, I'd find some relief with medication, but they'd always seem to come back, and they'd usually come back with a vengeance. So university was really fun.
Yeah. So you were taking like medications probably pretty regularly, I'm guessing.
Yeah, I don't leave even now, it's just out of force of habit. I don't leave the house without Advil. I don't leave the house without Gravol, because if I get a migraine, I have to pop the medication, and then I'm usually having to pop Gravol to make sure I don't lose my stomach.
Yeah, because they have all those medications have
Yeah.
side effects. So that was your life for however many years, and I know people always tell me this. They sort of get used to it, but it's one of those things that you don't really know. You've had it a long time and you're suffering with these things, but then you don't know how good it could be if the problem could go away.
Yeah.
Right. So, by the way, before I get more into the story, I ask people this because how do you think stress can bring on a headache or migraine? Do you know how that works?
For me, stress is because I tend to hold stress all in my shoulders and in my neck. So I would guess that everything would I don't even realize I'm doing it. It's all tight and stiff, and my jaw will start to go. And yeah, so
right. You nailed it. Yeah. So what I try to teach people is that when we have stress, one of the like just general human being responses to stress is a contraction of the muscles, often of the neck, upper back, shoulders, like the fight or flight posture when we're under stress. And accompanying that may be we talked about the sympathetic nervous system, and it may change blood flow patterns to areas of the brain. All of those things can set off and trigger headaches and migraines, especially. So the connection there also being that if you have issues in your neck and then the stress comes and it puts more pressure on those areas, then that can be enough to set off a headache or migraine. So, because people will, and I talked about this in my post this week, people will say, well, I got a headache because of stress, or I got a headache because of a weather change. And I want people to know that you have to have a pre-existing problem for those things to happen, because then when the weather changes, for the people that don't get a headache, why don't they? Well, they don't have those same problems. So, so what was it that prompted you to come see me for some help?
So I'd been having lower back issues. I'd had that since I'd had my son. And I'd gone to see a massage therapist and thought, oh, this is fine. Go for massage, try to relax, it'll be fine. The 1 hour massage therapy session triggered off not one, not two, but 3 full-blown aura migraines in a row. And I finally had enough. I'm like, okay, let's try going back to a chiropractor again. And
because you had gone and you weren't they weren't able to maybe adjust your neck or something, you mentioned?
They worked really well with my lower back. They tended to fix my lower back to a point where I could at least function and was able to walk. Mm-hmm. But they would immediately start to adjust my neck and they trigger a headache or they trigger a migraine. So yeah, having back problems weighed with whether or not I was willing to go see somebody who could trigger another migraine was kind of, all right, so it was a leap of faith to come see you and hope to God you weren't going to do the same thing again.
Well, and just to address that, and every doctor, every chiropractor, they're doing their best to help you. But what I've seen over the years is that we gotta find an approach that works best for the particular person. So if you notice with you, like sometimes, often for your neck, we're adjusting you seated in a chair, right? Yeah. That's going to work really well for a lot of people. Other people might do better on the table. Other people might do better with the drop table or an instrument adjustment. So it's kind of like that initial time when you're working with the person trying to figure out what's the best approach to help them and not, to your point, trigger anything. So we did an exam. We took x-rays. I like to get a really good comprehensive understanding of what's going on with this patient before we start working with them. But we started you under care, and just talk about what that was like and what began to change for you.
So even with the very first adjustment, you were the first one with my neck. The first thing I noticed, I actually could breathe better, which was weird. All of a sudden I could feel air actually passing through my nose a whole lot better. Did not expect that, but never had a reaction. You readjusted the neck, felt 100% better on the neck. And I'm like, I don't have a headache. I don't have a migraine. This is awesome. I'm going to keep coming back.
Excellent.
Yeah, the frequency of my headaches drastically started reducing. I think at one point, what was it, 2.5 weeks into my treatment, I'd seen you more than half a dozen times, and all of a sudden I'm like, okay, like my equilibrium is off. It feels like I'm walking on a tilted room. And you're like, yeah, no, it's fine. It's totally normal. I'm like, okay, well, that's good, because this feels really weird.
And that quickly, or you kind of
that's
right?
yeah, after after another couple of adjustments, it was fine. Like, it was just, everything seemed to even keel. So things as simple as going to get your hair cut, you have your neck back in the sink,
Yes.
didn't hurt anymore. Like, I didn't realize my neck was so off, I guess is the best way to put it, or out of alignment, until we started doing regular treatments with it. And now all of a sudden my curvature is back, so I can actually lie down and in comfort and have them do something as simple as wash my hair, which is kind of a really strange feeling. But
so you're now, just to backtrack for a second. So when you came to see me, on average, how often were you getting headaches and migraines, like per week, let's say?
2 to 3 times a week.
Per week. And over the, like, how quickly did the frequency change over the weeks or months that you were coming initially? Do you remember?
It took probably around, I started noticing a decided difference about 3 months in.
Yeah.
So that's when you started noticing that if I did get a headache, it was just a headache. It wasn't blowing up into something much more. That if I had to take if I had to take like an Advil, it was, you took it once and I didn't have to repeat it another couple of hours later because, oh my God, it's coming back again. So that was even just the frequency. And I'm no longer, like, our Advil bottles last a whole lot longer in the house now, instead of having to constantly buy it.
Yeah, that's good. And now you're, how often now?
Full-blown migraines about once every 6 months. I saw you the last, I'd had a full-blown one, and then I had started to get one, and I actually just happened to be seeing you that morning, and you literally could see it as down one side of my body as it was triggering. Yeah. And it was like, okay, it's fine. But the adjustment took away the 2 days of, if I cough or I sneeze, the head still feels like there's no pain, but the head feels like it's in a vice. Oof. And I didn't have that after effect, which is the first time I've ever had that. But I was in the middle of a full-blown migraine when I saw you. Yeah.
Well, there's a couple things I want to mention there. First of all, that's amazing. I'm really glad you've been able to have this great change to live without, basically, headache free or migraine free, except for the rarest times.
Yeah.
People watching, to understand that changing the body takes time. Yeah. Even if you get that first adjustment and you go, oh my gosh, my neck feels better and this, like that, that's a temporary change. But if repeated, then tissue and joint function and nerve function will actually the changes will become more lasting and permanent over time. And that's when the real stability comes for you from a symptom perspective, where, like, consistently now you know that you're rarely going to get them, because we've actually changed the structure and function of your spine. And so that takes time. How long? People want to know, how long does it take? It might be 3 months, 6 months. For some people, a year. Depends on when they're coming in, how bad their situation is and how long they've been that way. So, we try to give an estimate of that when we start someone on care, and we were pretty close with what we estimated with you. So, those are great changes. And the other thing I always feel compelled to do as your doctor is to talk about lifestyle things. So can you say a little bit about, like, how stressful your job was?
COVID changed the aspect of my position. So luckily I still was employed and able to work from home, but I went from working, the standard 8 or 9 hour day, and my days became somewhere between 12 and 14 hours.
Wow.
All the time. So I'm sitting at my dining room table, and I'm, in a somewhat uncomfortable chair, and I'm constantly there, very few breaks, getting up very few times to be able to get up, even though the kitchen is right behind me. And I've either always on call, and there's a lot of stress going on because there's a lot of work that has to be done. So yeah, I mean, my lower back was feeling it. My neck would get stressed out, and we noticed that when we went into full COVID shutdown, because after I think about 4 weeks or so, you called up and you're like, how are you? And I'm like, oh God, I need an adjustment, because I started to notice my neck was tightening up. I was now starting to have to take a little bit more medication. And that was because I needed to keep remaining in treatment in order to prevent this from reversing itself, because I knew I couldn't go back to where I was with like constant headaches all the time.
Right. And there's a lot there. So one thing being that like sometimes like your job is stressful,
yeah,
but you don't have a choice. You're not going to quit, and you've got to there was a time where you just have to do those 12 or 14-hour days. And so I was just trying to, we're trying to support you through that until such time that you can change. And I would say things like, get up from your chair, walk around the evening. And some days you can do that more, and some days it's harder, but you're just doing the best with it. I mean, the other part too is that we're actually still changing your body. So it's not, we would call it maintenance care, if you're coming, once a week or once every 2 weeks. But the reality is, with what we know about the body now, as you continue these healthy habits, your body can still actually improve how it functions. So there's even more stability for you as your care continues and as your lifestyle changes. So now if you're going to, get into a job where you don't have to work as many hours, you don't have to sit as long, it's less stressful, then that's another where you could go up another level of well-being and improvement. So I'm excited for you to head there.
Yes.
Yeah, which is good news. So any last things you want to mention? I mean, I'm trying to think. I was a headache sufferer too before I got into chiropractic, and I wasn't skeptical per se, but can you think of anything you want to share with someone that might be watching and thinking, they've suffered a long time, they've tried different things, and any last things you want to mention about your experience?
I've seen 1 or 2 chiropractors, and the one thing I can say is your neck. I've never seen somebody take the care and time to adjust the neck like you do. You figure out what the issue is and what the problem is to attempt to, and you'll keep trying until you hear the crack that you want to hear, or the adjustment. You get more excited about it than we do, to make sure that it's where it needs to be and how it needs to be. Absolutely amazing chiropractor. Like, I wouldn't go to anybody else. And I tell, like, even my husband watches you on TikTok now. It's hilarious. I love it.
That's good to hear. Well, thank you for sharing that. And I just want to say too, like, out to again, anybody watching, like, it's nice if they want to come see me. But I mean, other chiropractors, you got to find the right fit for. So you're a good fit for me. I might have some patients that came to me, they weren't a good fit, and then they found a good fit with somebody else. So I don't claim to be above anyone else, but I'm happy to help you, and that's working out really well. But if you're watching, you could come see us, or you come see another chiropractor and just see what might be possible for the person to get relief. And just, again, I can't stress enough, give it time, because real change. I mean, it was dramatic for you, but for a lot of people, it might not be as dramatic. They might have to get care for longer to get the benefit. But if we do find spine problems related to someone's headaches, chiropractic could be huge for them to get them the help and relief they're looking for and improve their quality of life.
Yeah.
Thanks for sharing your story, Catherine. And I'll see you at the office soon.
Okay, sounds good.
All righty.
All right.
Have a great one.